first video chat, we focused on the importance of the first 2 weeks after birth in getting started with breastfeeding and lactation. In this video chat, we're going to focus on what to expect during the birth hospitalization in order to get your breastfeeding off to the best start possible. Key to the initiation of lactation is that breastfeeding is frequent and effective. Effective means that your baby is providing the necessary stimulation while drinking milk. Several hospital practices are key to getting off to the best start possible with breastfeeding, including breastfeeding immediately after delivery, not being separated from your baby for non-medical reasons, and help from a skilled lactation expert should a problem arise. If you anticipate needing a breast pump because you have a late preterm birth, or you will be separated from your baby or some other reason, check that a hospital-grade, multi-user electric breast pump with initiation technology is available for each mother, because sharing pumps after birth will interrupt your frequent schedule. Let's take a minute to review hospital policies that can influence your breastfeeding experiences. Several studies suggest that breastfeeding your baby immediately after delivery makes a big difference in having enough milk and breastfeeding for as long as you plan. While most hospitals promote breastfeeding in the delivery room, some may exclude cesarean birth and other pregnancy complications. Similarly, many hospitals say that mothers and babies are not separated, but in some hospitals, separation occurs for non-medical reasons. Among these are the time between when you give birth and you arrive into your postpartum room, or your baby's being taken to a different room for a physical examination or a blood test. Many hospitals advertise availability of a lactation specialist, but oftentimes the lactation specialist may have limited hours or also have direct patient care responsibilities in addition to assisting with breastfeeding. Check these policies at your birth hospital and make sure that your breastfeeding plan is communicated to the doctors and nurses. Let's review what is within your control in the hospital. First of all, feed your baby frequently, about 10 to 12 times each day while you're in the hospital after birth. One of the most important things is to tell family members and friends not to visit you in the hospital unless you are 100% comfortable breastfeeding in their presence. Too often, mothers postpone breastfeeding using pacifiers or letting visitors hold the baby and miss the baby's readiness to feed. Second, whoever stays with you in the hospital, the baby's father, your mother, your sister, should do the other baby care, including diaper changes and baths, and bring the baby to you ready to breastfeed. This helps you save your energy, sleep when you can, and make breastfeeding your number one job. Third, take the pain medications your doctor has prescribed as you need them. These medications do not affect your baby, but they do affect your ability to relax and let your milk flow. Finally, know what is normal for you and your baby, and what are red flags that signal something might be wrong. So now let's talk about what is normal and what are red flags during this period of time in the hospital. Research shows that healthy full-term babies, not separated from their mothers, breastfeed between 10 and 11 times in the first 24 hours after birth, but drink only about a half an ounce of milk for the entire day. For healthy babies, this is plenty of milk. Also, know that feedings don't start and stop in the sense that your baby wakes up, feeds for 20 minutes, and then falls back to sleep for 2 to 3 hours. These breastfeeding patterns develop after the first 2 weeks, when the milk supply is established. Expect your baby to spend long periods at the breast, but sucking irregularly, almost appearing asleep at times, but still latched onto the breast. Then when your milk starts to flow, sucking will be very fast, followed by a pause when the flow of milk slows down. This is how babies drink enough milk during the first day or two after birth. Mothers often think that babies' nonstop feeding means that they do not have enough milk, but this is not the case. Instead, your baby is drinking colostrum, the milk that you make in the early days after birth. Colostrum is more like a medicine than a food, so your baby does not need large amounts of it. Colostrum also works like a laxative, helping your baby have frequent bowel movements, and that reduces the chances of jaundice that requires treatment. So what are normal sensations for mothers during the initiation of lactation? You may notice temporary breast fullness, leaking, discomfort, and uterine cramping and bleeding, especially during and after feeding. Sensitivity to heat and more perspiration are also normal symptoms. So we've talked about what's normal. Let's talk about red flags that suggest something might be wrong. Not that it is wrong, but that we need to watch it. Although tender nipples are normal at first, nipple pain and tissue breakdown are not normal. It is also normal to struggle in the beginning with achieving a good latch for breastfeeding, especially if you are a first-time mother. However, if this problem continues, if you cannot latch your baby after a few minutes of trying, ask for help from the hospital lactation specialist. Breastfeeding with an ineffective or painful latch quickly results in sore nipples and engorgement for you, and lack of intake for your baby. Lack of urine and bowel movements on the second day of life may also be a red flag, suggesting that your baby may not be drinking enough milk. So let's summarize our video chat with 3 takeaway messages. First, check that practices supporting breastfeeding are in place at your birth hospital, and communicate your breastfeeding plan in advance. Second, plan to breastfeed 10 to 12 times daily. Limit visitors to those who do not interfere with breastfeeding frequency. And recognize that normal breastfeeding is not a wake up, feed, and go back to sleep event during the initiation of lactation. And third, do not overlook sore or bleeding nipples, engorgement, or the inability to latch your baby comfortably and effectively to the breast. Ask for help from the lactation specialist.